Good afternoon and welcome to the Loop Scoop. Today's episode focuses on harm reduction, which has been a debated topic since a public health emergency was declared in 2016 and has now claimed over 7,000 lives. Government, health, and community service providers alike have struggled to find solutions to the crisis, developing numerous interventions aimed at reducing the tragic loss of lives. Harm reduction is one of these interventions. Harm reduction is a public health strategy aimed at reducing the risks associated with certain behaviors. In particular, today we're going to talk about the behaviors associated with substance use. Harm reduction acknowledges that while people engage in risky activities, there are ways in which we can reduce the harms and the adverse effects associated with that activity. According to the BC CDC, this pragmatic approach is supported by a growing body of evidence demonstrating its effectiveness in improving healthcare-related outcomes. Harm reduction represents a compassionate, evidence-based approach to managing the risks associated with substance use, meeting people where they're at, and by focusing on minimizing the harm rather than insisting on abstinence. These strategies provide practical solutions that save lives, reduce disease transmission, and improve public health. TowardTheHeart.com is a BC CDC created platform and website for harm reduction resources and services. Building on their previous advocacy efforts, in 2023, Harm Reduction International launched a campaign calling for divestment in the drug war and an increase in spending of harm reduction social and community programming. Global harm reduction campaigns aim to build a broad and diverse coalition of people from allied social justice movements, calling on governments and donors to divest from punitive approaches. Harm Reduction International has pushed for drug policy to be included in human rights discussions at the international level. Harm Reduction International collaborated with partners to make over 20 statements and submissions to UN bodies highlighting human rights violations committed in the name of the war on drugs. Why does this matter? Well, according to Harm Reduction International statistics in 2023, 275 million people use drugs every year. 191 countries criminalize drugs, and 39% of people who inject drugs have hepatitis C. Additionally, 34 countries have retained the death penalty for substance use and trafficking. Harm Reduction International states they are committed to centering equity across the world, and they highlight the negative impact of criminalization and the compounding effects of intersectional vulnerabilities, specifically how drug policy interacts with gender, ethnicity, race, poverty, and socioeconomic status. One of the most well-known harm reduction strategies is the implementation of needle exchange programs. Currently, the BC CDC provides these supplies free of charge without the requirement of the one-for-one exchange. Studies conducted by the BC CDC demonstrate that providing sterile injection equipment significantly reduces transmission of HIV, hepatitis C, and various other blood-borne infections. The BC CDC stands behind their policies of harm reduction after finding that cities with needle exchange programs and safe injection sites saw a substantial reduction in HIV prevalence among people who inject drugs compared to cities without such programs. This reduction not only benefits the individuals directly involved in substance use, but also decreases the overall public health cost to treat such viruses and infections. Another significant harm reduction strategy is opioid substitution therapy, such as the use of methadone, Suboxone, buprenorphine, and a variety of other medications. These medications help stabilize individuals, reducing their use of illicit opioids and consequently lowering the risks of overdose and infectious disease transmission. According to the World Health Organization, opioid substitution therapy has been shown to decrease opioid-related deaths, improve social functioning, and adherence to other medical treatments. But we'll dive further into the topic of safe supply in another episode. According to Harm Reduction International, these facilities reduce the incidence of overdose deaths and provide opportunities to engage people who use substances with health and social services, potentially leading to treatment and recovery. My guest today brings into the conversation his expertise in Indigenous perspective when addressing healthcare-related solutions. In order to find viable solutions to address the continued tragic loss of lives to accidental overdose, Canada's colonial history and systemic racism need to be addressed. The injustice became impossible to ignore after the In Plain Sight report was released in November of 2020, which made visible the outrageous amount of anti-Indigenous racism within the healthcare system. It is more important than ever to take a holistic approach to harm reduction strategies that are inclusive to all. It is my absolute pleasure to welcome to the show today Jordan White, who will be discussing Indigenous Harm Reduction. Jordan brings his insider knowledge and expertise as a proud member of the Métis Nation. Jordan is a clinical counselor, an Indigenous Knowledge Exchange Lead, and currently works for Len Pierre Consulting as an Indigenous health consultant. Jordan has presented on topics all over the world, sharing his belief in communal and shared leadership and cultural humility, with an impressive resume, which includes the credentials of being an Indigenous-focused oriented therapy and complex trauma graduate, as well as an Indigenous advocate with the British Columbia Association of Clinical Counselors Provincial Education Committee. I had the privilege of meeting Jordan through the Transformative Holistic Action team earlier this month, and also was able to take a workshop with Jordan today. So Jordan is an incredible person with a passion for human rights and has kindly taken the time to share his experience with us today. So Jordan, first off, thank you so much for allowing me to pick your brain. I feel you provide a unique perspective, one that everyone should hear. And I'm already a fan of yours, but would love to know more about you. So Jordan, would you please tell myself and the audience a little bit more about yourself?
Sure. Swale say Jordan Telsqui, Talitokwa Boni Boni B Cree Nation, Mestawasis First Nation. Good morning, I'm Jordan. Some of my roots come from northern Manitoba, which is Boni Boni B Cree Nation, as well as central Saskatchewan, which is Mestawasis First Nation. I didn't know about my Indigenous roots for a lot of my life, and I'm finding over the years I have connections to lots of different places, and I currently belong to Mid-Island Métis Nation, which is on the Coast Salish, Kwakwaka'wakw and Coast Salish, Kwakwaka'wakw and Nuu-Chah-Nulth territory, and I'm living currently what's colloquially known as Mission, British Columbia, the shared territory of the Camel, Sumas, Matsqui, and Kwantlen First Nations, and been invited to Thompson Rivers University here today and to share some things and engage in dialogue with folks about Indigenous research, about Indigenous harm reduction, about engaging in good relationships. And I think that's what my work is. It comes back to, for me, the Métis flag, the weaving together of Indigenous and non-Indigenous ways of knowing, doing, and being. And a word I learned recently is Wakotowin, and it means having good relations and having all the responsibility and the accountability to maintain those good relationships. And I find in my work that's what I keep coming back to, is that idea of a relationship, that idea of coming together in a good way, that idea of supporting one another through that. And when I think about who I am and where I'm from, I think about challenges I've had in the past. Being admitted to psychiatric facilities and going to different treatment programs, and both Western and Indigenous healing ways have been helpful for me in my journey. And my work as a counselor, I find that that is also helpful for the folks I walk alongside. I use the terminology walk alongside very intentionally because I believe that I'm sharing from an elder here by the name is Len Pierre, and he says, "Do not follow, for I may not lead. Do not lead, for I may not follow. Let's walk together and see what we can accomplish." And so I find myself speaking to different groups, whether it be Black, Indigenous, people of color, LGBTQS plus folks, immigrants and refugees, and I find it's about that walking together in good relationships with people, and with that Wakotowin, that good relationships and the relationships that come with it. That's just a little bit about me and some of my experiences and how I hold myself in different spaces.
Thank you for sharing that. That was a beautiful quote that you included. You have so much experience in many different titles. Did I capture that correctly? Is there anything I'm missing?
I've facilitated conversation and been part of only a couple countries, not worldwide. I've spent some time in working virtually in Singapore, in the UK, and a couple different places in the States. And also I teach at the University of the Fraser Valley, and I'm also part of a treatment program called TELUS Optik, which is a treatment center at TELUS First Nation. So I'm a clinical leader there, and then a contracted faculty at University of the Fraser Valley.
Awesome, thank you. How did you first get involved with harm reduction as a strategy in addressing healthcare-related issues?
How did I first become involved? I came across this individual by the name of Len Pierre, and perhaps you've heard of him and some of the work that he's involved in. How it originally started, a lot of my experiences and a lot of my knowledge that I have is built in relationship. What I'm sharing today isn't mine. It's made in relationship. It's made with experiences that I've had with human and non-human, might I add. I've found my opportunity to attend Sweat Lodge. I had to attend my first one a couple weeks ago, and it was quite transformative and quite healing. So throughout my whole life, I've found myself those experiences and those understandings of knowing a bit more of who I am and where I'm from led me to working at a large organization where I was invited to share about two-eyed seeing. And what two-eyed seeing is, it's a word from the Cape Breton, the Mi'kmaq territory in eastern Canada, and two-eyed seeing, Edawaptamuk is the name for it in the language, Cape Breton. And so I just became so excited about it. I became so interested in it, and that it represents that weaving together of both Indigenous and non-Indigenous ways. For the better of all people, and that's what Mi'kmaq elder Albert Marshall says quite regularly, is it's for the benefit of all people, for all of my relations. And if that word is new for listeners, it means the four-legged, the two-legged, the ones that swim, the ones that crawl, the ones that fly, the planted, the rooted, the finned, the feathered, all of those include all of our relations. And I think we need to be walk very carefully, because we weren't here first. Plants came before us and trees came before us, then it was animals, and then us as humans were the most vulnerable. And so I think those creation stories, as I just mentioned, I keep hearing them time and time again. And so back to your question about, harm reduction and where it comes from, I think it probably started, say, if you want a specific time, I would say maybe 6 or 7 years ago, I started becoming involved in a more education type capacity. But as a clinical counselor, I've been engaged in harm reduction type work for a long, long time, about meeting people on the street and bringing tobacco ties to them. Just yesterday, I was out sage picking with a group of people with lived and living experience in Merritt, and that's harm reduction in and of itself. And so as a clinical counselor, I find that I meet people outside. I find ways to include what's important to them. For example, there's a group of youth that I was working with, and they love to be on their phones, like most youth do, right? And so we're like, let's make a photography group. Let's take pictures of things that are important for us, and let's go for a hike through the forest. And so, that's harm reduction in of itself. And when I think about what some of the elders said, yesterday, and what elders have told me, it's very much, following what, Indigenous knowledge keepers and leaders and elders have said. That's what I think Indigenous harm reduction looks like, is finding ways to, listen to our elders about the knowledge and experience and stories that they have about the land, about the water, about coming together, about ceremony, about smudging. These are incredibly valuable, important, and when I think about colonialism and some of the factors that contribute to the suppression and oppression and hatred and all these different things, I think that we need to find ways to decenter some of that white Eurocentric narrative and recenter some of those voices of marginalized and oppressed folks, LGBTQS plus folks, immigrants and refugees, BIPOC folks, and because that would cultivate a bit more balance. I find myself speaking only of a few things about balance, about relationship, about dialogue, and weaving together knowledge systems. And I'm making the differentiation between dialogue and debate, where when we think about colonialism, when we think about tools of colonialism, debate is a tool of patriarchy, and it creates division, it creates polarization, it creates a winning-losing type atmosphere, and it's not very generative in my view. It needs to be much more relational, much more dialogic, much more connected with the people in the room. And when I think about the question that you asked here, I forgot parts of it, but some of it's about how did I get started with the harm reduction aspect. I would say, a couple of years ago, I say 2018, I started more in the education, consulting, supervisory aspects but I've also been involved with it for a lot of years as a counselor, and, been raised with it, like the seatbelt that I wear, when I was a kid, that's harm reduction, those kind of aspects too. So it's been around, I would say, my whole life, but I didn't start educating and talking to folks about it in this type of capacity until the last 6 or 7 years ago.
Thank you. Yeah, you answered that question and more. Probably the next few too. I think that's such a great addition to what the mainstream idea of, harm reduction based on, keeping people safe is, the main idea with, life contains risk, and how do we make things safer for people when we know that they're engaging in risky activities? The way I try and explain to people is, like, if you want to cross the street, right, there's going to be risk associated with possibly being hit by a car, but you use a crosswalk, can keep you safer. Or riding a bike, you wear a helmet. There's still risk associated, but we know that people are going to engage in behaviors that come with risk. So what you just mentioned is such a beautiful addition, just such a plainly structured notion of looking at harm reduction. So yeah, I appreciate your framing it that way and just bringing your knowledge. So Jordan, what would you say to those who may not be supportive of the current approaches of harm reduction, or even further supportive of Indigenous harm reduction?
The first thing that comes to mind for me, and I think some of this was shared earlier today, about the importance of relationship. We can disagree with one another, but we can still treat each other with respect. We can still treat each other with kindness. We can still treat people with dignity. And I find when we engage in dialogue rather than debate, it centers our common humanity. It really centers our humanness. We're not so different from one another, you and I. And when I think about other people who might have differences of opinion than me, I can still treat them as a good human. I can still walk alongside them. I can still be with them and treat them with all those things of respect and dignity and just being a good human. And so I think that I mentioned Wokotwin a bit earlier about having good relationships and have a responsibility within those relationships. I think it's really important just to highlight those aspects of our common humanity, and it's okay to have differences of opinion. I think it'd be a problem if we all had the same opinion, and so what I think that dialogue can do in that safe enough environment, it can touch people's hearts, it can open up people's minds, and it can find ways to meet people somewhere in the field. And I'm going to quote Rumi, who's a poet. It goes, "In between right doing and wrong doing, there is a field. I'll meet you there." And so I think about that because there's so many ways to yuck with it, to heal and to straighten out. And that's a teaching of one of my elders. Her name's Nancy Patricia Charlie from St'Alis First Nation. And she held up sage and sweetgrass in one hand, and the other hand she held up a ceramic church and a ceramic cross. And then she said, there's many ways to yuck with it, to heal and to straighten out. It needs to be done with squallowin, with good heart, good mind, and good feelings. And so when I think about your question about, people might have differences of opinion with, I think it's just being curious. I was driving with some with lived and living experience yesterday on my way to Merritt, and she says, ask questions. That's so important for her and her work that she's done with youth and research, and being curious and having an open mind and just really creating that safe enough space for dialogue. Because if we talk about assimilation, when we talk about genocide, when we talk about patriarchy or white supremacy, there's a level of risk in having those conversations, but we need to have that vulnerability and that courage to engage in that. Because when I think about shifting systems, and we think about transformation to be a bit more equitable and a bit more just for marginalized and oppressed groups, I think we need to have that place for dialogue, for that safe enough where it's okay that we don't disagree with the person beside us or in front of us, but we can treat them with that respect and dignity that they deserve, and really appreciate where they're try to understand where they're coming from with their knowledge, their background, their experiences, and why they might be saying what's important to them.
Awesome. I completely agree with everything you just shared. And thank you for kind of underlining the part about a safe space to share. Because when we are encouraging people to talk about things that are heavy subject matter, right? We want people to feel comfortable, and we don't learn by only knowing, hanging out with people that think the exact same thing that we do, right? It's giving space for people to be able to share those, and then we know better how to engage with people that don't. So it was almost a trick question to. I can't only ask questions that I know will go one way. So another thought that I have for you. Knowing all that you know, what is your perspective on potential ways to address the toxic drug crisis?
Yeah, the first thing that comes to mind for me is, as I shared earlier, our relationship, our common humanity. And also, when I think about the history of prohibition, when I think about colonialism, when I think about race-based policies, like prohibition or Indian Act or these things, I think about finding ways to include that in that safe space, the safe enough space that we're talking about. Because what I hear time and time again, and I think it's really important to prioritize and privilege, is that the toxic drug poisoning crisis is a health issue. It's not a criminal one. And when we think about people who are in prisons, and we think about people who are apprehended, when we think about people who have health disparities, and when we think about people who are engaging in violence or sex trade to fuel their addiction, a lot of it's from trauma, a lot of it's from hurt and pain, and a lot of historical things that contribute why people are using in the first place. And so you want to think about harm reduction and the importance of it. It's saving lives so people can be with their families.
You're right, and the notion of the harm reduction being an enabler. I kind of think of it as the only thing that naloxone enables is people to breathe. It gives people another day to exactly find their passion, find their calling. And why do people? Everyone deserves that. And even if it's 100 times more, it doesn't matter. If we're able to save people's lives, then we should.
Agreed.
What are you currently working on? Any projects, any initiatives, any calls to actions that our audience should know about?
Some of it was highlighted today in an earlier conversation that I had. And what that conversation was about is finding ways. There's a myth in Ireland, and it's called the Irish Fifth Province. I'm not sure if you've heard of it, but when I don't know the whole story, so please go back and take a look at Imelda McCarthy's work and Noel Byrne's work, and who are the leaders and the founders of the Irish Fifth Province, and what this looks like in terms of counseling and psychology and finding ways to be together. And what this myth is there's 4 provinces in Ireland, and the 5th province is, historically people used to go there, they put down all their weapons, they put down all of their harmful aspects, and they had this 5th province where they engaged in dialogue, where they talked about the differences of opinion that they have. They talk about these aspects of being human and treating each other with kindness and respect and dignity. And one of the quotes that I have is making the private public. And so when I think about the question that you asked in terms of projects I'm involved in, it's a lot of ideas of making the private public. And what I mean by that is, community-based interventions and finding ways to let the public know how inequitable, how unjust things are from a lived and living experience perspective. And so just, as an example, including peers, as I shared, I work at TELUS Optik as well as a clinical leader, and there's phase 1, 2, and 3, and within all these different phases, detox, bed-based care, and aftercare, we include peers with lived and living experience because they need to be there because of the experiences that they have. And so, one of the projects that I'm working on is finding ways to bring the voices of lived and living experience, bring the voices of people who whose voices need to be heard. The homeless person down the street, they have a story that needs to be heard. And so I think we need to find places where we can amplify voices of those that haven't had the opportunity because of, people might be homeless, they might be in substance use, might have mental health challenges, they might be, have family complications and all these different factors. And I think we need to find ways to hear from them about making that private public, because it would find ways to destigmatize some of the toxic drug poisoning crisis that's happening. And, not everyone is, going around and hurting people just because they use. And when I think about, people that I work with, they have stories of so much power and so much grace and so much love. And that also needs to be heard about people who, use substances and they're okay. They're not going out and robbing people. They're not, going to the street and engaging in violent activity. They're just humans like you and I, and they're just using substances because it works for them. And so some projects that I work on is that kind of working towards community-based projects to destigmatize, to depathologize, to find ways to center our common humanity and uplift those voices who haven't been given the opportunity that they deserve.
Thank you. Yeah, you touched on such an important thing, the focus on people with lived and living experience and the storytelling. So you're probably aware, but my research for my master's program, that's what I'm focusing on, is giving amplification to these voices that are often silenced and not heard. And so much of that has to do with colonial histories and structuralized racism and oppression and all these things that aren't necessarily visible. So this relates to so much in the public-private. So it's such an interesting perspective. Thank you for sharing that with us. So how does it feel for you doing this work? I know it's personal and it's heavy, but you're making a huge difference from my standpoint. So how does it feel for you?
In my life, I didn't know about being an Indigenous person for a lot of my life, and still learning who I am and where I'm from. And it's attending Western treatment programs and attending Indigenous healing programs and going on a canoe journey was deeply healing and deeply helpful for me, and finding more balance in who I am and where I'm from. And being on that journey, I find myself seeing things a bit more clearer, things that are not as balanced, and things that need a bit more work, and things that need a bit more support. For example, when I think about our colonial systems, their healthcare, education, justice, child welfare, all of these are scaffolded from that white Eurocentric narrative that, privileges being cisgendered, privileges heterosexuality, it privileges, male supremacy, it privileges all of these things. And it's grossly unbalanced in my view. So, I think our systems need to move towards a bit more balance, and so decentering some of that white Eurocentric narrative and recentering some of our marginalized and oppressed voices is, I think, one of the best things that, we can do to create a bit more balance for, knowledge democracy, so we can really recognize that there's missing, dismissed, and distorted voices everywhere that needs to be in leadership positions, that needs to be in positions of power, that need to be heard. So I believe this is called a StoryHive project, and so the importance of stories is really, really important and really valuable. And to your question about how this is showing up, learning more who I am and where I'm from has really contributed to me wanting to help move other things and other places, other structures towards balance, because it's going to be helpful for everyone. It's not going to only be helpful for Indigenous people or non-Indigenous people. It's going to be helpful for everyone if things are a bit more balanced, if things are looked at a bit more holistically, if things are looked at more interconnectedly. And so when that brings me hope, and I see that as some of my responsibilities to help people bring them towards hope, or walk together towards hope, because we've seen the numbers for the toxic drug poisoning crisis. We see the numbers for different groups. When we think about climate, for example, we look at droughts, and we look at wildfires, and we look at displacement, and we look at all these different things. And so I think some of my role or responsibility, I suppose, is bringing together people in those circles to have a good dialogue, because those differences of opinion, as you asked me a bit earlier, those can be really valuable to creating new, innovative, and creative ways to address things. And yeah, those are a few things that kind of just come to my mind, is just moving towards balance, and it just fills me up, because there's lots of things that are unbalanced, and I just want to find ways to meet others in that circle.
Thank you for sharing all of that with us today, Jordan. It makes me think about, I believe it was Johan Yari that said the opposite of addiction is connection. And I think it's having these conversations like you and I are having today, and sitting down with people in our community, and we're only gonna find solutions if we sit together and work together. So yeah, I'm just very grateful that you came today to talk to us. I have one last question for you.
Okay.
So if our audience members wanted to get involved in ways to address the toxic drug poisoning crisis, what would you suggest? Do you have resources or ideas for things that people could do?
The first thing that came to mind for me, and I really need to pay a lot of appreciation and gratitude to Len Pierre, and he has a TED Talk called Decolonizing Substance Use, so that might help spark some ideas too, is taking a look at that TED Talk on decolonizing substance use. Another thing I've been thinking about, and I mentioned a bit earlier, is finding ways to amplify voices. I think this project in and of itself is a massive undertaking with a lot of work and a lot of really, really important lessons to share with the broader communities about destigmatizing, about depathologizing, and these things. I think about there's lots of agencies out there. The Canadian Drug Policy Coalition, for example, has some really great work out there that folks are doing in terms of harm reduction and decolonizing substance use, and finding ways to support people who are struggling with substances.
Once again, Jordan, I appreciate you taking the time to come today and chat with us. And I know Harm Reduction International is another one of those organizations with a lot of projects on the go. And yeah, if you want to find out more, we can provide that info here. So thank you, Jordan. And I hopefully I will get to see you again soon in your next workshop that you deliver here into Kamloops. It's for the Secwepemc Nation.
Beautiful. Thank you so much for having me.
Yeah, thank you.
Take care.